Welcome, ladies and gentlemen. My name is Rowan Pett, Executive Director here at the Australian Chamber of Commerce in South Korea. Today's webinar, Post-COVID Transformation and Medtech Opportunities in Northeast Asia. Today's webinar is proudly co-hosted by the Australia-New Zealand Chamber of Commerce in Japan and AustCham Greater China. The webinar will cover insights into the Japanese, Chinese, and South Korean markets with our three very special guests from Intralink. Now, without further ado, I'd now like to pass it on to our moderator, Rodney Commerford, Senior Trade Commissioner of Austrade Seoul.
Thank you, Rowan, and I'd like to first of all thank the various chambers for hosting this event today, and obviously looking forward to the presentations. I guess firstly, just touching on the year that nearly was or has concluded. 2020 has obviously brought immense challenges for everyone in every corner of the world, but what it also has highlighted the need for, I guess, the importance of our health infrastructure and our R&D foundations, and I guess that's one thing that Australia certainly excels at in terms of we have very strong foundations built upon our world-class universities, our institutes and precincts, which are all supported by government investment and which help drive cutting-edge research and development. And I guess it's through this research and development that that many of some of our leading medtech solutions and devices are born. Certainly, knowing from where I am here in Korea, two of Australia's, I guess, leading medtech examples or case studies are both Cochlear and ResMed, who are both well known in this market, as I know they are in both Japan and China. And I guess it's these type of innovations which only come about through having the talent, but also the ecosystem to help develop that talent. So I think if we look post-COVID, the opportunities presented in these markets, and I think all the markets have responded differently in terms of how they've managed COVID. However, certainly in the case of Korea, the economy continues to perform relatively well. I think probably one of the best in terms of OECD. China is obviously is recovering quite well, or probably even better than that of Korea. And Japan is probably a little further behind. However, there's still significant opportunity there. So I might leave it there because I know our three guests today will speak in greater detail about their respective markets. But once again, I'd like to thank everyone for joining the call today, and look forward to discussing some questions after the presentations. Thanks, Rowan.
Thank you very much, Rod. So now I'd like to introduce our first presenter, Charles Cielo. He'll be providing insights into the Japanese market. So Charles, may I hand it over to you?
Indeed. So let me just turn on my mic and my video. Just a minute. I presume everyone is seeing my screen. So everyone, good morning, good evening, wherever you happen to be watching this from. I hope everyone is having a great day, and thank you for gathering. Today I will be speaking about digital health and robotics related opportunities in Japan, and I will also be giving you some tips on how to manage market entry. Just a minute. The talk will follow the structure outlined in the agenda, although we will be having our Q&A session at the end of the multi-regional talk. So without further ado, let me start the talk with a self-introduction. So my name is Charles Cielo, and I'm a project director who oversees Intralink life science and medtech projects in Japan. My background is in biotech and pharma, and at Intralink I specialize in helping companies validate and enter the Japanese market. And Intralink is an international BD consultancy with a deep specialism in East Asia, based in the UK, but with personnel all over the world. We make commercial success in East Asian markets fast, easy, and cost-effective. We work in multiple industries, of which, as I mentioned earlier, I take care of our healthcare and health-related businesses in Japan. To begin with, let me pose the question, why should you be interested in Japan? Well, the simple answer to that is that Japan is a very large and sophisticated market, as you probably already know. It's the third largest medical market in the world, with multi-billion-dollar pharma, medical device, and IVD markets. It's also home to a huge research market. We also have a large patient base that is only expected to grow with the aging of the population. For these reasons, practically all major global players have a presence in Japan, competing with domestic companies for market share. Aspiring market entrants can look to Japan's social needs to map out opportunities. Japan most urgently needs solutions for its aging population. Japan's population is projected to shrink from 106 million to 88 million by 2065, with a proportion of the 75 plus age group projected to rise from 14% to up to a quarter of the diminished population by 2065. Now, this age group is important because it is the most resource-intensive group to support both medically and non-medically. For example, the cost of non-medical community care services grows exponentially from age 75 and onwards. Financially, we have somewhat adapted to the increasing cost of community care by increasing public caregiving insurance premiums. And beyond this, the government is increasingly looking to allocate more of sales tax revenue directly to medical and community care. Community care costs are highlighted because dementia prevalence also increases with age. And this subgroup is most likely to need non-medical care like feeding and bathing assistance. The Japanese Ministry of Health, Labor and Welfare projects that Japan will have over 6.75 million dementia patients by 2025, and this will increase to 8.5 million by 2060. Now, naturally, Japan is already preparing for the crisis. The Ministry of Health, Labor and Welfare has enacted some initiatives that might represent opportunities for prospective market entrants. So the MHLW, as we affectionately call it, defined 8 critical services that it wanted to have in place by Japan fiscal year 2020. And these will gradually evolve into more ambitious health initiatives from 2021 and beyond. These include cancer, AI, and data handling goals that are designed to make the current system more effective and aligned with the needs of the times. Products that are aligned with these initiatives are more likely to gain both clinician and public support. And I'll be introducing you to some of the products that have made it to the market as a reference for what products Japan needs now and will likely need in the near future. Please note that these products require nuanced approaches for market entry. Some markets are too immature and are still waiting for feasible business monetization models to materialize. And ideally, the best products for market entry are those that could be seamlessly slotted into existing workflows with public health or community care insurance coverage. Now, the most high-profile initiative of recent years is precision oncology. We inaugurated public health insurance covered precision oncology testing late last year, and adoption is increasing at a stable pace. The system is managed by 12 core and 33 hub or subcore hospitals that run molecular tumor boards and participate in clinical trials, while supporting cancer genomics initiatives of 122 liaison hospitals that are networked under the core and subcore hospitals. Now, the entire system is centered on CCAT, or the National Cancer Center for Cancer Genomics and Advanced Therapeutics. It's a government agency under the MHLW that is both a national repository of cancer clinical data and a vehicle for leveraging this data to increase therapeutic options for Japanese resident patients via the application of big data and AI. If you want to bring in a solution for precision oncology, be advised that you will not be able to ignore CCAT. Beyond cancer genomics, we are also aggressively looking at other applications of AI to clinical workflows, be it in pathology and diagnosis, or more mundanely, hospital operations. Now, DTX is still nascent in Japan, but we approved our first DTX solution, Cure App, a smoking cessation app, this June. And Cure App will be closely followed by an insomnia solution, SysMed, which should get approval sometime this year, or maybe early next year. Aspiring market entrants should pay attention to these pioneering DTX solutions because they set precedents for regulatory approval, insurance coverage, and specifically for patient-facing apps, localization of messaging that is targeted to end users. Now, Japan is somewhat behind in terms of healthcare ICT, but many small networks are emerging to leverage ICT to improve the quality of life of residents, particularly the elderly. But healthcare service providers need to follow industry guidelines that are designed for compliance with government guidelines. The overall system is designed to increase consumer trust and usage by increasing choice and quality of service. While the sector is large, it is designed to be very competitive from the start. Further, Japan has strict data privacy laws, and it applies double to clinical data because these are defined to be sensitive by law. B2C models for non-medical solutions where products are not covered by public health insurance are possible, albeit at the cost of limitations to marketing claims and pricing, especially for apps, because there are a lot of free apps that are available on both Google and Apple platforms. As an example, we have here the new dementia prevention solution that is sold to individuals and corporations that combines a preventive social program with the world's smallest brain activity measurement device. Now, the AustCham app follows a freemium B2C model and is one of the most successful health apps in the nation. It's primarily a calorie counter and a diet advisor app, but 4.5 million of us users are using the app daily to keep track of our daily nutritional intake. The MyConet in Kyoto is a solution to enable clinicians to access patient lifelog and real-world data, and it is a model for hospital industry collaboration. While it's also possible to access the market via partnership with a private life insurance company, which are also entering the space. Now, taking care of the elderly cannot be done purely via software-based solutions. The elderly need physical help. So we are also developing physical solutions to fill in the gap. In 2013, the Japanese government developed a 5-year plan for developing nursing care robots as part of our vision for what we call Society 5.0. Now, this involves making solutions that are physical in nature, like transfer aids, mobility aids, toileting aids, bathing aids, and some that have more of an ICT component, like care services support. And some of these products have already borne fruit and delivered real products to the market. Here are examples of wearable and non-wearable transfer aids. And Kukichi was the first to reach the market with a B2C solution. So it makes a pneumatic muscle suit that is the first exoskeleton that you can buy from a brick and mortar consumer electronics store. I personally got one from my in-laws, and I can say that the 20 kilogram plus load reduction capability does make a difference in ameliorating the effort involved in caregiving. Similarly, Cyberdyne has been making waves for some time now with its powered exoskeletons, which can be used for industrial applications, for community care, and as well as physical therapy. But I believe it mostly follows a B2B model. RAA, robot-assisted activity solutions, have also hit the market in droves, targeting elderly family members who are living by themselves. And these take many forms. But arguably, I mean, what I personally consider the most sophisticated, best documented, and cutest solution is the Sony Aibo, which was the subject of a small but positive study in 2013. Not all RAAs are smart solutions, but AI is increasingly a standard feature. The developers of the Aibo certainly understood dogs. And playing with the unit I got last year, I can see that where it can support the psyches of isolated elderly, with its ultra-realistic interactivity and ability to learn. As a bonus for caregivers, it can also be used by family members as a remote camera and keep track of their elderly family members via programmable AI-enabled face tracking, watchdog functionality. Now, Japan is a rational system, and entering the market is not a Herculean task. However, there are challenges that need to be understood and addressed. First and most important for medical solutions is that Japan is home to one of the largest and most sophisticated public healthcare systems in the world. The only public system, in fact, that supports top 3 largest IVD, pharma, and medical markets, medical device markets, while ensuring universal coverage, high quality provision of services, and world-class clinical outcomes for a population of 127 million. The practice of medicine is considered social infrastructure in Japan, and it is a unique system where you have a single-payer public insurance system that represents the ultimate revenue source for virtually all therapeutics and diagnostics expenditure, and the end user facing pricing for medical products is uniform nationally, but the delivery of these services is mostly private and laissez-faire. And we can say it is a very successful system, and actually that is part of the problem. We residents enjoy affordable universal coverage that is age agnostic, with a cap on overall medical spending, and specialist care is easily accessible in any of the 8,000 plus hospitals and 100,000 plus clinics all throughout the nation. And this is particularly so because we don't have GP or a restrictive gateway system. As a result, average life and healthy life expectancy is on the rise, as you can see in the figures. And you can say that the system has been too successful because now we need to find a way to take care of the increasing number of people who are living well beyond their 70s. It is no joke that we're already preparing for a world where one needs to plan to live up to 100. And we also have unique business practices that need to be considered when making a go-to-market strategy. Probably the one that most most people stumble upon is the fact that many Japanese companies tend to work through dealers and distributors, even though these add, let's say, price levels and cost levels to a transaction. Now, Japan maintains its own standards and practices. So FDA or EC certification is only useful as reference, but the PMDA will make its own decisions. For submissions to get approval, you will need a market authorization holder or an MAH. And as you can see here, the MAH is ultimately the entity that is responsible for ensuring that the medical device meets Japanese quality and safety standards. And it is very critical to successful market entry in Japan. Now, there is the MH is effectively the right to sell a product in Japan, a medical product in Japan. And usually a distributor owns that. But recently we have also allowed, let's say, a version of the MH program where the manufacturer owns the right and only designates it to a distributor or a local entity. We call that the DEMA. And you will also need certifications as part of the submission process, but this should be no surprise. You need the foreign market accreditation, the QMS, and of course you will need to meet Japanese industrial standards. And for these certifications, you will need to engage different and multiple agencies. So for example, the MAH, the license for that can only be gotten from local governments, but you make your submissions to the PMDA. Sometimes, depending on the class of your product, you only need, let's say, to work with certification bodies instead of doing a full review by the PMDA. And for medical devices in particular, we have a classing system that is based on risk to patients in the event of device failure. And this is, and I'm showing you here is the standard process for application and approval. So an applicant makes their application to the PMDA, who then does the review, and they may do an inspection depending on the class of your product. They may do a site inspection, and then when they grant approval, there might be a follow-up inspection post-market. Now, I'd like to give you some tips relevant to entering the Japanese market. First and foremost is don't assume that marketing strategies that work overseas will work in Japan. And this applies also to messaging targeted to KOLs and customers. You need to confirm the match of needs and clinical consensus with the product service claims of efficacy or benefit. You need to know what the standards of care are and expect that it will take time to replace them if at all possible. You need to know that you need to know what your competitors are doing in Japan and make sure that you're clearly differentiated from them. You need to determine your ultimate revenue source because this is a key part of your strategy. And of course, I mean, if you're handling data as a medical device, an ICT solution, you need to make sure that you are compliant with Japanese guidelines for data handling, which is somewhere between, and Japanese privacy restrictions are somewhere between GDPR and the US. So it's not quite as strict as GDPR, but not quite as loose as HIPAA, for example, in the States. So, and you also know, like if you're selling something to hospitals, I mean, you should know that if it's not directly related to clinical outcomes, clinical benefit, hospitals in general are in the red. So your customers will always be cost sensitive. And for this reason, I mean, you should know like how your product or similar product classes are currently being sold in Japan. And while we do have expedited approval, it is for certain products only. And approval does not mean market access because the public insurance really is what you need to access the bulk of your market. So overall, you should plan your market entry, sales, and registration strategies together. Now, I'll give you a couple of case studies of companies that we have helped in Japan. So case study one is a UK-based a device maker with a strong track record in the EU and the US. And it asked us to help it understand the Japanese market. So we did a market study, understood the competition and regulatory requirements. We built up a KOL and distributor candidate networks, and effectively built up a supply chain from scratch. But it came to light that one of the materials used in the device could not be imported in Japan because it did not comply with Japanese industrial standards. And basically this prompted the manufacturer to put everything on hold for several years. Now, case study two is another UK-based company, this time an IVD maker. The product is a golden standard IVD that is used for a particular indication. It's already being sold in Japan and reimbursed. But it asked us, I mean, to help it understand why it wasn't making as much money as it was in its #1 market, the US. Similar to the first case, we did a market study, determined standards of care, best practices, and competitors. And ultimately, we found out why revenues weren't quite as high as expected. And this was related to how the test was used in Japan. And we also built relationships with KOLs. We added a PI to a clinical study. And we also helped capture an account from a big brand competitor and help the client develop a strategy for defending its dominant market position in the nation. So last but not the least, I'll give you a bit of an update on COVID. So as you can see here, it's not quite as peachy as it was, I mean, a few months ago. Right now, I mean, we still think we are somewhat still in control of the pandemic. And despite a recent flare-up, in-person trade shows and meetings are still possible, although rare. So our national caseload, total infections is like 172,000, with severe critical cases in the 500s, with mortalities in actually recently, as of today, it's like 2,600. recoveries, I mean, most people recover. But right now, I mean, because of a recent flare-up, a lot of people are still in the hospital recovering. So the graphs you see, it's the kind of old. So there's actually, it's missing a peak that we are experiencing in July and in November, December. And it's that peak that is mostly linked with a government program for promoting in-country domestic travel and eating out that has been shown to actually double the risk of contracting the disease. Our approach to COVID has always been no lockdowns because the Japanese government cannot legally do it. But and there are no restrictions to movement in country from the very start. But we do have good voluntary compliance to social distancing, masks and whatnot, and proactive. So the government is doing a lot of proactive contact tracing, contact tracing, not contract tracing, and cluster mapping. We have restricted some entry from overseas with mandatory 14-day quarantine and pre-testing. Our treatment options, which I believe is kind of unique to Japan, is listed as below. This is what is recommended by our National Institute of Infectious Disease. They involve, obviously, you have remdesivir, which is no longer WHO recommended. Dexamethasone is a steroid. We have favipiravir, which is a viral inhibitor that was developed in Japan. Ciclosinide is also a viral inhibitor and a glucocorticoid, which is also developed in Japan. Actemra is an IL-6 inhibitor that was found in Osaka University, and then licensed in by Roche. And Futan, the famostat, is a serine protease that was developed by, funny enough, the pharma arm of Japan Tobacco. So that is all for now. If you have any questions, I mean, I'd be happy to cover them at the end of the session. Thank you very much.
Thank you very much, Charles. It's great to hear your insights into the Japanese market. Now, moving ahead, I would like to introduce Ruslan Tursunov, who will be providing his insights into the South Korean market. Ruslan, may I hand it over to you?
Yeah, thank you very much. Thank you, Robin. Let me start my presentation here. All right. Yeah. Hello, everyone. Thank you for joining us today. My name is Ruslan Tursunov. Originally from Uzbekistan, I have lived in Korea for almost 11 years now, and I'm fluent in Korean. I started my career at the biopharmaceutical company in Korea as a product manager for biopharmaceutical products, and I was in charge of the client and dealing with clients in Central Europe, Eastern, Western Europe, and some Central CIS countries. And after joining Intralink, I have mainly focused on life sciences and medtech sectors. And so far, I've helped about over 24 of clients in genomics, precision medicine, advanced medical technologies to enter the Korean market. Yeah, today I will be providing some overview over about opportunities in the medical devices market in Korea, which is rapidly growing due to the government support and easing regulations and so on and so forth. Before going to the details of medical devices market, I would like to give you some general overview of South Korea. The population stood at 51,780,000 as of December 2020, and 15.7% of the population is aged at 65 or over. And as you can see here, this is becoming a major problem for the government, and I'll talk about it a bit later. It would be okay if it was the only problem. The thing is, fertility rate is also decreasing dramatically. You can see here. And in 2018, South Korea entered the kind of world's anti-record range, which is fertility rate was below 1, 0.98 or 7. And it went down further in 2019. It was 0.92. And it is despite the government's support. Now, over the past 10 years, the government has been investing like about $200 billion into promoting births, but it's not happening. And especially in 2020, we're afraid that because of the uncertainties due to the COVID, there might be some decrease. We'll see, and we will keep observing this, and then we'll draw some conclusions. And economy-wise, South Korean economy is world's 12th and Asia's 4th largest economy, with a GDP of 1.7 trillion US dollars. And you can see the growth here from 2010. It's been growing exponentially, like you can see here. And in 2020 as well, despite the corona situation, we have seen a stable growth in the Korean economy, especially in exports due to PPE and other medical devices that have been required from Western Europe, Western countries, and so on. So, and also Korea is one of the major investors into R&D. The country spends slightly under 5% of its GDP into R&D, and this is the highest R&D spending to GDP ratio in the world. And in absolute terms also, it's no slouch. The country is among top 5 after China, US, Japan, and Germany. And it spends about $75 billion into R&D only. So, Korean Ministry of Health and Welfare is in charge of the citizens' health and welfare, as it says, and it provides near universal healthcare under the National Health Insurance Service system that covers about 97% of the whole population. And despite spending only 8.1% of the GDP into healthcare, the country has a high quality, efficient, and affordable healthcare system. And it was ranked the 4th most efficient healthcare system by Bloomberg in 2018, by the way. And South Korea boasts large hospital bed to population ratio, which stood at 13.5 per 1,000 citizens. And it's second only to Japan. And it's quickly catching up with the country as well, with its neighbor. This is important. Over 62% of medical devices in the market, the demand for medical devices is supplied by US, Europe, and Japanese companies, and some other companies as well. But mostly these the supplies from these markets are dominant in the Korean market. And one of the important factors contributing to the use of high-end medical devices and equipment from overseas is that most Korean doctors are educated in the US or Europe or Australia, for example, in Japan. And when they come back to Korea, they request their hospitals to purchase this type of high-end materials or devices so that they can continue providing their own practices, their services at a high standard. And US accounted for 51% of the whole imports, and Germany 18%, Japan 11%, and then other markets. And of course, if we don't talk about the dominance of a few big 5 hospitals, it's going to be unfair to say, okay, I talked about everything. No, the only big 5 hospitals that are located in Seoul treat around 5% of all outpatients. And according to some expert estimates, they treat about 70% of all cancer patients in the country. What does it mean? It means there is a very, very good place for clinical trials. So if you come to Seoul, you can speak to 5 hospitals who are treating 70% of all cancer patients. So you have all the patients that are needed for your trials in one place. So this is a hotbed for clinical trials. Okay. The Korean medical devices market was estimated to have reached $7.1 billion in 2019, making it the 13th largest medical devices market in the world. And it's still growing. If you look at the past 5 years, it has been growing at the annual growth rate of 10.4%. And last year in 2019, we saw a record high growth, 15%, about 15%. But it is still heavily reliant on imports. And if you look at the import growth rate, it was about 10% annually for the past 5 years. And last year it grew 13.5%. And top 10 imported medical devices include contact lenses, stents, MRI and CT systems, knee prostheses, and IVD reagents. And there's one interesting fact about the imported devices. Ophthalmic lenses, 99.2% of all ophthalmic lenses were imported from only APAC countries. So I would assume that most of our listeners would be interested in understanding the regulations. It's a prerequisite for medical device sales in any country. So we will go to the regulations now. Certification is required for all medical devices for production, import, or export in Korea from the Ministry of Food and Drug Safety, that is the equivalent of TGA, Therapeutic Goods Administration of Australia. And for the registration purposes, medical devices are classified from class 1 to class 4 based on the increasing risk of medical devices to human health or human body. And class 1 only requires notification. You can just notify the MFDS and then keep selling your products. You don't need any approval or anything. But when it goes to class 2 or class 3, 4, you will need to have a specific approval from the MFDS. And as soon as you get the approval, you can start selling, otherwise no. And so I can give you some examples for these classifications. For example, surgery table can be class 1, or coronary stent can be class 4. Anesthesia systems can be class 3. But just make sure that before you come to Korea or before you apply for regulatory approvals, you need to make sure which class your product is in, because even if it's called the same name, depending on the material you used, it can be it can fall into a different classification. So let's say even stents, if it's made of metals, it can be a different class. If it's made of plastic materials, it can be in a different class. So it really depends on what you have used in the target. So reimbursements. National Health Insurance Service is in charge of everything related to reimbursement, and it covers or decides not to cover, how much to cover, and sometimes even if it has already been decided about the coverage, if let's say the burden of a patient is too large, then NHIs can extend the coverage. It really depends, case by case. And the major payment system is fee for service, but DRGs are available for certain types of illness groups. I'll talk about this in this next slide. So more on the reimbursement. So any medical device can apply for reimbursement application, reimbursement after the regulatory bodies approved for sale in South Korea. And if there is a kind of similar predictive device already available in the system, then your product can get the code and subsidy allotted for that specific device. It means, okay, it has been already decided, you have no choice, you will accept that. And then it's easier as well. But if there's no similar product already in the system, then you will need to go through a specific process for reimbursement for approval. And there is one more thing. Even if your product is similar to the existing one, but you think that your product is more efficient, in that case, you may decide, all right, no, I'm not agreeing with this subsidy. I want to get more. Then you can apply for a higher reimbursement subsidy and you will need to go through a reimbursement approval process, which may look at the efficiency and so forth. Then, if HIRA or NHIS decides on the if they agree with your product and claims, then you will get the allotted subsidy, higher subsidy. Reimbursement included under the procedure fee. We're talking about DRGs. In 2002, the South Korean government implemented DRGs, voluntary DRGs, and then they trialed for about seven or 10 years, and then in 2013 it became mandatory for all hospitals. Actually, this DRG has been adopted from the Australian DRG system, so it's quite similar. It was at least quite similar at the beginning. And now all the hospitals have to work under DRGs, and they have to accept for 7 disease groups only. And the normal patients will pay only 20% of the whole procedure fees, and some other patients with specific, how can I say, preferences, they can pay less than 20%, up to only 5%. And in 2009, the government implemented another type of DRGs that's called new DRGs. And this is available for 567 disease groups, only in about 100 appointed medical institutions. Most of them are national institutions. And for private hospitals, this is voluntary. If they want, they can do that. Yes, non-reimbursable products, what does it mean? It may be old products that have lost their efficiency to rival devices, and it has become really obsolete. Then the HIRA decides not to extend the coverage for another year or for the future. And it might be other types of devices that are really, really new, but they cannot prove more efficient than the existing ones. So they were not allowed reimbursement, but they are still allowed to be sold in the Korean market. And there might be some products that didn't at all apply for reimbursement. So these are the non-reimbursable products. What does it mean for foreign manufacturers? There are advantages. If there is a reimbursement, it means the cost of the product would be borne by the National Health Insurance Service. It's easy. Patients are receptive to getting this kind of to get to hospitals using this kind of devices, and distributors are quick to adopt these products because they're easy to be sold. But disadvantages are that if your technology is slightly better than the existing ones, but it cannot prove much better than the existing ones, in that case, your product may not be allotted subsidy. So you will be outside the reimbursement system, which will be difficult for your company to sell in the Korean market. Yep. And it will be difficult to show the value proposition to hospitals if it is outside the reimbursement system. So what are the key drivers? Aging population. Yes, rapid graying of the Korean population has become a major problem for the government as to how to service this large population, and and provide really good, high quality medical services at an affordable prices. That's why the government has been looking at the use of digital health, and also, as you may already be aware, Korea has the highest number of plastic surgeries per capita because it has been so famous. Some other people from some other nations are flying to Korea to get plastic surgeries. This is also increasing the use of medical devices here. And the prevalence of diabetes due to the modern and Korean diet has been increasing from 1.5% to over 10% of the population over the past 40 years. And although it's slightly decreasing, continued smoking in Korea has become the major cause of lung cancer. And actually, lung cancer is the major cause of cancer deaths. 23.4% of all cancer deaths occur because of lung cancer. And this is also increasing the demand for cancer treatments and therapeutics. Market trends, if we talk about this, new focus on quality and standards. Finally, recently, last month, at the end of October to be more precise, the long-awaited regulations came into force, which require all the medical devices on the market to be reviewed periodically for quality and efficiency. It didn't exist before. That's why even if like some products have been registered 20 years ago, they have been on the market, even if they are not really of high quality. What does it mean? This means a lot of opportunities for foreign countries. Why? Because Australian standards, Japanese standards, or US standards are really, really high than the ones that exist in Korea. And as their products registered mean the registration of their products in those countries means it's easier for them to enter the Korean market. And for companies who have registered their products 20 years ago, they will either have to come up with a new technology or leave the market. And in the near future, there will be a really big gap to be filled by foreign companies. And as we all know, due to the MERS in 2015 in Korea and COVID-19 globally in 2020, there is a strong drive to improve infection control quality. So they're looking at telemedicine, monitoring, and so on and so forth. And there is an increasing need for digitization, connectivity, and patient data management in hospitals. And yeah, I will talk about a little bit about the digital health market here. It's rapidly growing. It's expected to reach $5.9 billion US in 2020. So it's coming to the end. And there is a strong government drive, including investment and deregulation. But there are still some regulatory barriers around data sharing and telemedicine, which have to be dealt by the government. Of course, they're being dealt step by step, but it still requires some more effort. And as we have seen, Corona has impacted all aspects of life. And still in Korea, although there are some resurgence happening here and there sometimes, we can see that COVID-19 has been well in control, under control, and everyone was conducting business as usual. In-person trade shows and meetings are happening, even if they are rarely happening, as they are happening in Seoul and in other areas of the country. This is the total number of infections in the country. It's not daily infections like in other European or American countries, continent. This is the mortality rate as of December 11. And total cases per million population is 782. This is really, really low. This was achieved with the preparedness of medical institutions and government institutions, as well as the ability of the population to stand with the government against any crisis, because they have been listening to the government, they've been following most of the rules, and now we can see that it's fairly well in control. And yep, actually, so South Korean companies turn this crisis into opportunities because Corona. When Corona happens, some Korean companies came up with new kits, and they started selling to the US, Europe, and now the awareness of Korean market has significantly increased. Okay, this is part of the one of the focus areas for the Korean government, and that's why the government is trying to help by loosening the review process and so on. Yep. There's one thing that I would like to highlight. There is high quality medical data available in Korea. Even if it was not mandatory, most hospitals started implementing, EHR and AMRs in hospitals. Now it is 96.3% in hospitals and 95.7% adoption rate in clinics. It means there is a lot of high quality data for your solutions to come and to be implemented here. excellent ICT infrastructure, and so on. Quickly about the areas of interest in digital health information technologies. So due to the demand for connectivity and demand for flawless flow of information, hospitals are now giving up paper documents and now becoming more and more digitized. Seoul National University Buntang Hospital was one of the was the first hospital to go 100% digital in APAC, and now more other hospitals are following, which means they will need connectivity devices and solutions to make sure that everything is digitized. And the South Korean government decided that AI and big data is one of the major key drivers of the economy, and they passed a special regulation to review AI-based medical devices. In 2018, there were only 4 solutions, AI-based solutions available for use, but in 2020, it became more over 20 now. And until 2019, wearables and no wearable device was available for use as a medical device. But in 2019, as part of sandbox regulations, the government allowed Mimo Watch to be used, and then it became the first wearable device eligible for reimbursement in 2020. So we're seeing this kind of developments in the digital health area, and the government is supporting, so there will be more and more developments in the near future. And we can see the use of blockchain in medical applications for example, safe storage of medical data and secure transfer of medical data between patients and hospitals, or hospitals to hospitals, and hospitals to government institutions. I'll talk about telemedicine quickly in this slide. I think I don't have a lot of time here left. So can you imagine a country where telemedicine is not allowed by law? But if the only 20% of Koreans participated, it would create a market of $1.8 billion US. And that's why the government started using it, even if the President Moon Jae-in was against telemedicine at the beginning when he was campaigning for presidency. After becoming a president, he said the government officials came out and said, okay, we're allowing telemedicine, and they actually allowed limited telemedicine in one big province from July 2019. As soon as the results are out, we will see how the government will continue. And also there is one survey that shows that 54% of Koreans would be open to trying telemedicine. And of course, due to the COVID-19, the government allowed, can you imagine, it's illegal, but the government allowed hospitals to use telemedicine, to communicate with their patients, because their patients were feeling that they were left alone, as they were not allowed to visit some hospitals due to the corona, outbreak. So the doctors also started, changing their minds a little bit towards telemedicine. And now, because the word telemedicine is a taboo, the government is using another word for this, that's called untitled medicine. So we'll see the development soon. I've gone through the opportunities a bit earlier. Now we'll go through quickly. There are opportunities in healthcare and medical technologies for age-related conditions. Aging is a problem, and clinical IT systems and medical imaging information systems that are hotspots, and developing solutions for cancer or diabetes, hypertension, robotics-based surgery and treatment devices, and big data AI solutions for diagnosis, drug development, or in treatment or monitoring services, and medical equipment for telediagnosis and monitoring. Very quickly about doing business in Korea culture. Korean SMEs tend to be, fast moving because they're driven by a ferocious competitive environment, and project management tends to be ad hoc. So it requires a lot of room for, a flexibility from their partners. And yes, some people say that personal relationships are really important in Korea. Yes, I agree with them, but Koreans are still, open to cold outreach because, relationships should start somewhere, and it is true in Korea as elsewhere. And Koreans are fierce negotiators. They believe that there is a lot of room for negotiation, believing that you are willing to give up something for the sake of working with some Korean big large institutions. And market considerations, you as a medical device manufacturer, you already know that you need a local partner office in Korea in order to import any or export your products to South Korea. So you need to get it right, otherwise it may lead to flat sales or failure. Localization is important, but it really depends on what you're offering in Korea. And medical regulations, Medical Device Acts and PIPA are one of the stringent ones in Korea. So you would like to make sure that you are sure that your products meet the requirements or are not outside the legal premises. And some things to note is that regulations are partly available in English. So even if they are available, they are not up to date. They are translated really late. And you should make sure that you have a local support, because Koreans expect a really high level of support in Korea. These are the industry-related organizations and events. That's it. Thank you very much.
Thank you very much, Ruslan, for your insights into the South Korean market. It's fantastic to see. And we've had one more presentation. So I'd like to now introduce Olexandr Nykytyuk. Thank you very much for participating today. I believe you're going to be giving some insights into the markets in China. So now may I hand it over to Olex. Thank you.
Thank you, Ron. Hello, everyone. I hope you had very insightful takeaways from two previous presentations from my colleague from Korea and Japan. And now let me share with you my presentation on China. So I would like to begin with my self-presentation very briefly. My name is Olexandr Nykytyuk. I'm originally from Ukraine, but I've been living in China for quite a while, since 2007. I am a fluent Chinese speaker, and I'm a graduate from a Chinese university. After joining Intralink in 2017, I've been working as a lead of Medtech and life science, and the majority of projects I was related to were related to IVD and pharma space. You can see some cases of projects I was dealing with on your screens. All right, so I would like to start with overview of China as a country and its healthcare system. As we start, I would like to throw some facts at you about China. So to begin with, no big surprise, China is the largest country in the world. Every fifth person on Earth holds a Chinese passport. For us, perhaps more important is the fact that China is actually quite large in terms of its healthcare expenditures that reached the point of $931 billion US. To put this into perspective, the global healthcare expenditures were worth $8 trillion US by 2019, of which 3.6 trillion were attributed to the US market alone, and another 2 trillion were coming from the EU. So China came up third. And if you think that large country size necessarily mean great healthcare expenditures, it's not always the case. India, for instance, being very comparable in size, has only 1/10 of expenditures spent on healthcare as does China. Another important thing to mention is that healthcare expenditures are skyrocketing in China. Look at these numbers, 2009 and 2018. We see it's almost tripled in this period of time, and we'll get to know about the reasons why a little bit later. Speaking about medical device market as a part of healthcare market, it currently stands at the level of 81 billion. Again, to put this into perspective, according to Business Fortune Insight, the global market of medical devices was worth 420 billion in 2019, which makes China medical device market to be equal 22% of the global size. Now, if these are the basic data or basic statistical data from 2019, but if we look a little bit further away, I would say if I had to name one single fact that will play significant role moving forward, this will be an aging population. Not surprisingly, together with Korea and Japan, China population is getting older. So if we look at the relative numbers, 18% of people over the age of 60 and 12.5% of people over the age of 65 seem quite acceptable, especially if we compare this with Japan, for instance. But if we look at the absolute numbers, 12.5% means 160 million of people over the age of 65, which is 22% of the global elderly population. And more importantly, China is standing in the beginning of its aging slope. The infamous one-child policy that started 40 years ago brought China to the point when its elderly population is going to explode. If we look at the projections from the United Nations, here we are about at this point, it will grow to the point to the level of 420 million of people over the age of 65 within just next several decades. China is literally sitting on a demographic bomb, and so it attracts a lot of attention from the central government. Several factors that play out for the nation getting older. One is increased longevity, and another is fertility rate. Certainly, we are not at where Korea funds itself, but it is lower than the natural reproduction rate. The last thing that I wanted to point out on this slide is that China has quite a robust infrastructure in terms of facilities and people. So almost 1 million healthcare units, of which 35,000 are hospitals, and everything else is categorized under grassroots healthcare units, which can be rural clinics, this type of healthcare units. China has a huge army of healthcare professionals, almost 13 million, of which 3.8 million are clinical doctors. And again, if we look at numbers of the most recent past, we see that China is actually improving on healthcare quite a lot. Only 20 years ago, China had 2 million of clinical doctors, and today it almost doubles the size. This brought China level of the number of clinicians per thousand of population to 2.59, which is within the expectations of WHO regulations. Another important point that those clinicians are working quite intensely. Look at the number of patient visits. It's quite impressive, 8.7 billion according to the statistics of 2019. I would like to talk a little bit more about healthcare system, how it is organized in China. And when we speak about healthcare systems, in particular to China, we usually have to factor in the role of the state. So for many decades, the government was the main healthcare provider through working units that acted throughout their affiliated hospitals. This system changed after Chairman Mao times, when the economy was reformed and more people were finding themselves outside of SOE coverage, healthcare coverage. So the out-of-pocket spendings really soared, reaching 60% of all healthcare expenditures by early 2000s, which led to creation of social security system. The healthcare system in China, the way we know it, is based on a medical health reform that started in 2009. And in very simple terms, the goal of this reform was establishing affordable and sustainable universal medical system. So let us talk about some pillars or key components of healthcare system in China. I'd like to start with a delivery system that is based on hospitals. Hospitals in China are divided in classes. The higher is the hospital class, the more government allocations it can receive, the better are the clinicians in the hospitals, the better is equipment, and the more patients visiting those hospitals. Let's take a look at the data from Bureau of Statistics. Here we see that class 3 hospitals, also being quite few in numbers, they receive an astonishing 2 billion patient visits per year. Imagine how large those hospitals are. And lower class hospitals, also more numerous in numbers, they receive way less patient visits. Also, another point is that public hospitals, also again being less numerous, they attract way more patient visits. So this whole situation with class 3 hospitals really is demonstrating the unbalances in the system, and government is working trying to steer out patients from class 3 hospitals to lower tier hospitals. Now, the next component of medical system in China is its funding mechanism. I already mentioned that China implements a universal medical system, and which basically covers all population. Today, more than 95% of Chinese people are covered with insurance plan, and this partly explains why China has higher healthcare expenditures than India, for instance. So there are two basic insurance plans in China. One is for employed residents, and another for non-employed residents. Speaking about employed residents insurance scheme, its fund is consists from contributions from an employee and employer, while non-employed residents have two sources of income for its fund. One comes from the government, and another are individual contributions. It's very important that government part is quite substantial. It can be anywhere from 60 to 100%. So in normal situation, you would expect that the employee insurance scheme would be more prevalent, but it's not the case for China. In fact, more than 1 billion of people are using non-employed insurance scheme, and this is a result of some gray employment practices here in China. And this brings me to a very important implication, because rural this non-employed resident medical insurance is so prevalent, and it's largely prompted by the government. The whole medical security system social security system is very vulnerable and is largely prompted by the government. If we look at the balance sheet of two funds, we can see that the non-employed insurance plan has a very small balance by the end of the year, which means that fund is basically exhausted within 1 year. The number of incomes are equal to the number of expenses. This is very dangerous situation. More than once, we've seen local media reporting on local hospitals being ordered from top down to restrain the number of outpatient visits by the end of the year. Why? Because the funds were empty. All right, and this brings me to the third pillar of healthcare system in China. It's administration system. So with help of administrative measures, the government balances out this rocky funding mechanism, and it's making it more sustainable. In general, administration system optimizes expenses within the healthcare ecosystem. And today, the regulator uses a variety of measures to control the cost of healthcare. This may include adoption of diagnostic-related groups into payment schemes of the hospitals. Also improved optimization, improved procurement schemes in centralized procurement through centralized procurement offices. Also, another important way of cutting hospital expenses is by optimization price standards in a document known as a catalog of medical services and price standards, which is the basic document that regulates the scope of activities of a hospital. This catalog enlists services and its relative price standards. So just to give an example, let me demonstrate an excerpt from Shanghai Municipality catalog. Everything is in Chinese, but luckily the numbers are in Arabic, so we can read them. This is an excerpt from for prices that hospitals in Shanghai can charge patients for MRI services, and there are three price levels depending on different field of strength of MRI machine. So why it is important to monitor price standards, because changing in prices will lead to dramatic increase in or a decrease of your competitiveness in China. So it was a very lengthy intro, but hopefully it helps you to understand how system works, operates in China. Now let's move on to MedTech market overview. I have a number of slides, so I would like to share them with you one by one. Speaking about MedTech market growth, it's usually above 20% in recent years. As you can see, between 2014 and 2018, the MedTech market almost doubled in size in China. And if we look into the subcategories of or market segments of medical device market, we will see that medical equipment is the king, followed by high-cost consumables, and then low-cost consumables and IVDs. Because high-cost consumables such a favorable place for international companies, let me break down the subcategories of this vertical. Cardiovascular implants generates the largest revenues, followed by orthopedic implants, and everything else is less than $1 billion in relative market shares. Now, speaking about imports and exports in China, imports are growing faster than exports. It almost tripled within the last 10 years, but exports from China are also growing. It's double the size of 2009, according to the statistics of data from 2018. All right, the last slide here would be about the subsequent subcategories on imported MedTech products. And here, as we see, almost 70% of the share goes for medical equipment. All right, now speaking about trends and opportunities for MedTech companies in China. Trends in China are mostly revolves around two government initiatives. One already mentioned earlier is known under the name of medical reform that started in 2009. And the second is known under the name of Healthy China 2030. Perhaps you've heard about this initiative. If not, let us move to the next slide to look into it in a little bit more details. So on this slide, on this table, you will find the information about Healthy China 2030, its main principles, and also key indicators within this initiative. In very simple terms, both healthcare, medical reform, and Healthy China 2030 initiatives are both working on to building healthcare system that is well-balanced, self-sustainable, and fully in compliance with WHO recommendations on, in terms of longevity and also clinicians per thousands of population. All these things. In previous slides, I flagged some roadblocks that stay on the way to the policies that are outlined in Healthy China 2030. One is funding system being heavily subsidized by the government, and the other problem is high preference of hospital class 3 by preferences of hospital class 3 beyond among general population. And substandard quality of services provided by lower class hospitals. This brings me to several trends that the Chinese government sets for MedTech market. These trends include cost effectiveness, optimization of delivery system, effective biologic surveillance of and management of transmissible diseases, management of chronic diseases and orphan diseases, aging-oriented healthcare provision, and finally, preventive care. So within those industry trends, we find also opportunities. Let us talk about it in a little bit more details. So cost effectiveness, I already mentioned that government subsidizes the healthcare in China. So cost effectiveness is a long-term trend here, and rather than define it, companies should rather embrace it. For laboratory instrument and medical equipment companies, this means developing high throughput, high automated solutions that can help hospitals to achieve economies of scales and basically save on personal expenses. Remember, I mentioned those class 3 hospitals hosting 2 billion of patients. Imagine how large those laboratories are in those hospitals. Now, speaking about optimization of delivery system, China is currently working on creation of a hierarchical medical system in which medical institutions at various levels receive patients according to the degree or urgency of the diseases they have. And provided that the system works, those 2 million patient visits will be dispersed around lower tier hospitals. As was mentioned earlier, clinicians in lower class hospitals, they may be less trained and have less expertise. So easy to use and computer-aided solutions that can help and assist diagnosis will be of much use. And also telemedicine will help to tackle the issue of optimization of delivery system. Now, COVID-19, it's exposed strategic vulnerabilities of both hospitals and laboratories. So fast diagnostic solution, AI augmented solution, will be of much use in this area. And also during COVID-19 epidemics, we've seen a lot of hospital robotics cases in China. So companies may find opportunities there as well. Now, speaking about chronic diseases, they usually require timely screening, regular checkups, monitoring, coordinating of treatment, and very soon many diseases that are will turn into long-term chronic diseases such as cancer, for instance. So technologies that can streamline this the process of monitoring chronic diseases will be very much in need. Speaking about aging-oriented healthcare provision, very often it's deemed to have overlaps with management of chronic diseases. However, I think it's an independent area in terms of creation of home care solution, especially in maybe anti-fall detectors and other smart monitoring systems. Also in terms of wearables and innovative materials, and also 3D printing, especially in orthopedics. Preventive care, vertical is quite large to speak about it in any meaningful sense. Nonetheless, it's worth mentioning that Chinese are getting more increasingly aware of health aware and more willing to spend their money beyond what is required by hospital treatment. Now, speaking about COVID-19 and its impact on medtech, I would like to start by saying that China is very effective in preventing secondary spreading of COVID-19 within China. They achieve this by very effective screening measures when hundreds of thousands or perhaps even millions of tests are mandated in areas where single COVID-19 positive cases occur. This helped China to rebound and to rebound to the growth. In Q2 2020, China GDP growth was equal to 3.2%, and in Q3 the growth already reached the level of 4.2%. Now, speaking about the effect of COVID-19 on medtech industry, I really have a mixed feeling about it. Obviously, with hospitals restraining outpatient visits for months, had adverse effect on the industry. Many companies reported loss. Clinical trials were deferred, but at the same time, many many COVID-19 related industries were booming. Everyone knows the story about PPE and how China consolidated its dominance in the industry. But also IVD was really benefiting from this situation, especially molecular diagnostic. Some companies such as BGI, which is the largest and most respectable company, probably will grow 4 or 5 times. I wouldn't be surprised because of large government orders coming from different states. And also many companies spurred their innovation, rolling out very interesting instruments in molecular diagnostic. Also hospitals procured a lot of PCR instruments that will lay a groundwork for molecular diagnostic to be better accepted moving forward. Speaking about digital health, China was ahead of the curve even before COVID-19, but with COVID-19, China is even more focused on digital health. I don't have time to go into this area too deeply, but just to mention that the largest digital health operator, Ping An Good Doctor, has already 340 million registered users, and will soon reach the point of 1 million online consultations daily. Another important news that will further spur the development of the industry happened in the end of 2019, actually before COVID-19, with National Healthcare Security Administration launching the electronic medical insurance system, regulating the prices and insurance policies. And this opened doors for internet-based medical services to be covered by the country's medical insurance system. Now, speaking about China market entry, probably the first thing you will hear about China, if you're assuming that you are going to enter the market, will be the word NMPA, which stands for National Medical Product Association. It is an equivalent of FDA. National Medical Product Association is the main regulatory and administrative body that creates, implements, and governs all the standards related to medical devices and drugs, and also cosmetics. NMPA is responsible for pre-market and pre-market approval and post-market surveillance. So at some point you will definitely encounter NMPA. Most likely the most tedious work will wait for you when you register your product. Market approval regulations are quite patchy, not always crystal clear. They are prone for regular updates, and obviously there is a language barrier. Speaking about classification of medical devices, it's really close to what we have in Europe and the US. So 3 classes of products, and depending on their relative risk to patients, they are divided in class 1 to class 3. Regulation pathway is completely different for different types of classes of medical devices. Now, speaking about best practices to enter China, these are universal things, but let us discuss them in respect to China. So with accordance to vision, obviously you need to have clear vision about your respective vertical in terms of market, in terms of market size, prices, local practices, reimbursement levels. Then obviously you need to have the product that will be curved for China specifically. Chinese companies are not willing to pay for any engineering services, development fees. So you need to bring the product that Chinese companies will need. Speaking about logistics, it can be quite an intricate problem, especially in the beginning, especially if you deal with biological reagents. Getting those into China will be a major challenge. So you need to clear the way before doing business in China in terms of the logistics. Now, partners, the majority of failed cases are related to problems with partners. So you really have to choose the right partner to help you to enter China. Now, then presence, even if you have the best product and the best partners, you will still it will still be necessary to have regular visits to China, or perhaps you may end up deploying people here, or even create your local entity in China. And last but not least, trends and opportunities. You need to have a clear vision of the trends in China, opportunities that they present, and how you should deal with this. So speaking, provided that you are armed with all this knowledge, what you should do, the recommendation I usually make is to have your helicopter view on China even before you start, even before you come to for the exhibition. Just have a clear view on your product and how well it fits into China. I probably echo with slides from Charles here. then you need to identify the cost and time frame for your product. You need to have realistic expectations about how much time and what it will cost you to enter China. You have to arrange a comprehensive partner search. We usually recommend starting with 20 companies, long list that you shorten down to 6-7 companies, and finally you choose your partners. Registration agents in China, there are different options. You can assign your partner, you can assign yourself, and you can assign the third party to be a registration agent. You have to choose to make those choices wisely. Don't treat China as a side project. You have to assign people within your company that will work with China 24/7. It's a very special market. You have to act locally while thinking. You have to think globally, locally while acting globally. And perhaps the last thing to mention, Hong Kong can be a pilot project before you decide to enter mainland China. Because obviously it is a very, its regulations are quite lax if we compare this with mainland China. So in a summary, China is has universal medical healthcare, which opens a market of 1.4 billion people. It's a very sizable market in terms of medical devices, 22% of global market. Imports are growing quite intensely in the last decade, over 20% of growth year on year. There is plenty of opportunities in automation, point of care, personalized healthcare, innovative materials, 3D printing, and so on and so forth. But you have to be prepared for entering China. All right, I think I'm a little bit late, so I will, without further ado, I will turn over to our moderator. Thank you for your attention.
Thank you very much, Alex. And now I'd like to reintroduce our Q&A moderator, Rodney Commerford, who's the Senior Trade Commissioner here at Austrade Seoul. Rod, I'll hand it over to you. Thank you.
Excellent, thanks, Rowan. And I guess just obviously those presentations were by Alex and Ruslan and Charles were very comprehensive, and obviously some commonalities across the markets, but obviously quite unique characteristics as well. And obviously in terms of the population profiles and I guess increasing health issues, as well as I guess things such as surprising things such as in Korea. Obviously the story around telemedicine is an interesting one, but I won't go on about that much more because we don't have a lot of time. But I guess we'll just start with a question for each market. We'll start with Japan. So a question for Charles. Charles, the question is, does Japan have private insurance?
Yes, it does. But in practice, it is only used for supplementary insurance. So some hospitals actually do not have the capacity to receive money from private insurance because the practice of healthcare in Japan is predicated on the use with reimbursed goods and services.
Okay, excellent.
Yeah. So the way it would work would be like a private insurance would be paid to a patient. So a patient might get a plan from a private insurance company. The actual transaction, there will be no actual transaction between that company, the insurance company, and the hospital. The insurance company will pay the patient a flat sum. For example, if it's a cancer insurance, if the patient gets cancer, they get paid that flat sum, and then the patient then uses that for whatever copay it is that they pay. Like usually in Japan, it's 30% of the total medical costs up to a cap. And the cap is around $900 per month, depending on, of course, slightly depending on the conditions of the patient. So
excellent, thank you. Just another question just relating to Japan. I think it was partially covered in your presentation, but it's what is the first thing a company should consider if it is interested in entering the Japanese market?
So first, think about whether there's a match with unmet needs. So look at your solution, look at what the problems the system has, and then you think about, okay, does this actually solve a problem? Because the basic premise of business in Japan, the definition of business in Japan, is slightly different from how it is defined elsewhere. In Japan, business is defined as value generation So value is received by a buyer, and they are paid the corresponding just reimbursement rather for that value to the seller. So that is the basic premise. So you think about the value first, and then after that you think about how what is the current standard of care in Japan? Then and part of that would be thinking about what is your ultimate revenue source, and then that will help decide your strategy.
Excellent. Thank you, Charles. Now, a couple of questions for Ruslan on Korea. The first is, do we need to translate our solutions into Korean? And what is the main language used in Korean hospital management systems?
Oh, thank you. Yeah, good question for mostly foreign companies. They always think, oh, do we have to localize our solutions? It really depends on the product itself. For example, if it is a doctor facing, then they can be in English because most doctors have been educated in other countries. They're comfortable with English. But if it is a patient facing, for example, if it is a kind of digital consent, then they have to be in Korean, because you cannot expect all the patients to understand English and then agree with consent to any options or requirements. Yeah.
Excellent. Thank you. And I guess just leading on from that, what is, in your view, what is the best way to try and engage with the big 5 hospitals in Korea?
Oh yeah, it requires most big 5 hospitals work through their purchasing organizations, group purchasing organizations. Then it would be really good to establish kind of relationship with those organizations, or you can meet some of the mostly key opinion leaders, visit international conferences. That's another way of dealing with them. The third one would be working with someone who has relationships with those the key decision makers already established in Korea. For example, it can be Intralink as a consultant company who has relationship with them. Yeah, it's kind of 3 different ways.
Excellent. Thanks, Ruslan. And now I've got a question for Olex regarding China. In your presentation, you mentioned a lot of good practices for doing business in China. I guess, could you also elaborate on some of the things companies should avoid while doing or looking to do business in China?
Thank Rod. Yeah, it's a good question. It reminds me of a quote from Warren Buffett, who said he wasn't this rich because he made a lot of smart things, but he would rather avoid doing things that are not that smart. And yeah, I think I will give three things that you have to consider before as you enter China. One would be not to expect immediate results, especially if you are dealing with especially if your product is not selling itself, it's not unique. Your advantage will grow incrementally as you build up your channels, and this will be the main advantage, I guess, over the time. So 20 again, if we speak about the amount of efforts, the 20% of initial efforts will generate 80% of results for you. So it's really important to have patience and have this mindset while dealing with China. China is definitely worth the efforts. The second thing would be, I think I mentioned this in my in one of my slides about registration agents in China. We usually don't recommend to stick with your local partner for registration certificates. Unlike places where the registration fee is rather affordable, China can be quite pricey, and some companies may tend to share this relative fee with partners in return of certificates. But usually this ends up really badly for the manufacturer, and so the recommendation would be always to stick to the policy of keeping registration certificates under your own control, or find a third party. This can be your registration agents with NMPA. specialized companies who will help you to take care of your certificates and who has no conflict of interest moving forward. And I think the third thing not to do would be don't underestimate Chinese competitors. They are quite nimble in terms of their strategies, and they are very market oriented. So even if your technology is excel in current markets, it doesn't mean that you don't feel the pressure from local competitors. So that's another thing to do. Have the right mindset about your local competition. I think that's all I wanted to say. Thanks.
Excellent. No, that was a very, very comprehensive answer. Thanks, Alex. Now, I guess I note that we've gone over time, and there's a number of questions that were answered over the chat function. And I guess just to re-communicate to everyone on the call today that the presentations will be circulated after the discussion today. So at this point, I'll hand back to Rowan.
Thank you very much, Rod. Yes, we are a little bit over time, but I do really want to thank our presenters from Intralink. I would like to first thank Charles, Ruslan, and Olex on their insights into their respective markets, and also to thank Rod for his time and effort from Austrade in moderating the Q&A.